So the Western Cape's Emergency Medical Service says it's gearing up for a surge in call-outs. The province reported 2,447 new coronavirus cases. That was just yesterday. That's the highest increase after Gauteng. Feeling the heat of the spike, of course, in cases in the Western Cape are our first responders, the paramedics. For an update on the situation, we're joined now by the Director of the Western Cape's Emergency Medical Services, Dr. Shaheem de Vries. Dr. de Vries, good morning to you. We've talked a lot about shortages within our health facilities, but we really need to look at the fleet that we have as well. And our fleet, I believe, is at about, 260 EMS ambulances across the province. Is that enough?
Good morning, Naledi, and good morning to the viewers. I guess it will never be enough. We are, even before COVID, very scarcely resourced sector. And COVID certainly just has pushed us over the edge. But the teams are really putting in a great effort. And touch wood, we seem to be managing okay at the moment.
Yeah. When you go back perhaps to when we had our second wave, what were some of the worst moments for paramedics in the country? Perhaps paint a picture for us of just what your anxiety is in the coming weeks.
Yeah, so we're entering the same levels that we saw in the beginning of our second wave, which exceeds the first wave officially at the moment in terms of our case demand. And what we saw was an increase in the inter-facility transfers, so the number of transfers between facilities. And that makes sense as we see the number of admissions in hospitals increase. And so where we found that the greatest delay and then the greatest number of complaints were moving patients between facilities. And so we're trying to mitigate that at the moment.
Yeah. There's certainly been a lot of talk around public and private partnerships, especially where health is concerned in the country as we deal with this pandemic. Is this something that we need to be talking about with EMS services as well?
Absolutely, Naledi. I mean, we've had a great support from the private sector. We've had following on the first wave, we did quite a lot of work with our private partners on the side and engage them around pricing and resources. And when this came into good effect during the second wave, and so now as we start closer to those numbers that we saw in the second wave, we've started initiating those services once again. So we've procured additional private partners to accommodate largely the interfacility transfers. So our private partners do the uptick of transfers between facilities, and this has been a great boon for us during the second wave, and will stand us in good stead during this wave as well.
Yeah, well, do stay safe out there, and thank you so much for speaking to us. That there is Dr. Shaheem de Vries, EMS Director for the Western Cape.